Hi, my name is Glenn Dempsey. I'm a first aid student at Northeast Lakeview College. Today I'll be demonstrating how to perform rescue procedures for a choking infant. I chose this topic because it is imperative for every citizen responder to be able to react to these situations, as well as any parent or grandparent or bystander to be able to assist in these situations. A baby is not able to have the universal choking signal as an adult, and it's not going to have the strength it needs to be able to cough up its own obstruction. The first thing you want to do is obtain consent from the parents. You want to be able to get permission by stating your name, your skills, and your willingness to help. In this case, I am the parent, so there will be no consent necessary. I'll be performing the rescue on my own child. If the infant cannot cough, cry, or breathe, have somebody call 911 immediately and have EMS on the way. And in the meantime, what you want to do is hold the baby in a neutral position, face down, across your arm and on your lap with the head lower than the chest, and you want to perform 5 back blows between the shoulder blades. 1, 2, 3, 4, 5. And these are strong blows with the heel of your hand. You don't want to just coddle the baby or burp. You want to be able to clear that obstruction with 5 blows. Then supporting the head and neck, you flip over to the other side. Again, the head is lower than the chest, and you perform chest compressions. We're going to give 5 of them in an imaginary line between the nipple. 1, 2, 3, 4, and 5. Then you flip over, continue with more back blows. 1, 2, 3, 4, 5. Compressions. 1, 2, 3, 4, 5. Now I'm compressing about 1/2 inch to 1 inch, just enough to be able to move the chest. Don't be afraid of hurting the baby, and you're going to continue this until the baby's either able to breathe, cry, or cough, or becomes unconscious. Now in this instance, the baby's become unconscious, so you want to reposition the infant either on the floor or a hard surface as a table. Now remember, the baby's head is large in proportion to the rest of its body, so its natural position, it might create its own obstruction. So you might want to take an item and pad the shoulder blades to where it remains in a neutral position. With the head tilt, chin lift, you want to be able to give 2 rescue breaths. Now you could pinch the nose and just breathe into the mouth, or you could try to cover your nose and mouth with your mouth all at once. 1, 2, and then perform 30 chest compressions, again between the nipple line. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And at this point, you want to look inside the mouth for the obstruction. If you can see it, use your small finger and remove it. If you cannot see it, don't do a blind sweep, as it might push it down further. And you want to continue the cycle of compressions, object check, and 2 breaths until the object is removed, the chest clearly rises, and the baby's able to breathe on its own, or EMS comes in to take over. Okay, for a quick review. The baby is conscious and choking. 5 blows. 1, 2, 3, 4, and 5. Chest compressions. 2 fingers between the nipple line. 1, 2, 3, 4, 5. Back blows. 1, 2, 3, 4, 5. Compressions. 1, 2, 3, 4, 5. The baby has become unconscious. So at this point, move to the table, begin CPR procedures previously learned. Head tilt, chin lift, 2 breaths. 1, 2, chest compressions. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, and 30. Look for the object, We don't see it. I'm going to give 2 more breaths. 1, 2. Then begin the compressions. 1. And there we go. David is revived. Thank you guys. Good luck.